Thank you. And once again, I'm representing President Mahama. He expresses his apologies for this last minute hitch that made it impossible for him to join you personally. He's really committed to global health and public health, as we all know him to be. Um, he's very, very happy for this invitation by the Department of Global Health, Stellenbosch University, South Africa, and for all the great men and women who are doing the wonderful work to ensure that we have a safe period to be able to transition through this pandemic and also to prevent future pandemics. And in doing this, he seeks to ask us to explore options that will help us halt the current COVID-19 pandemic, prevent future pandemics. And even if they do occur, because we know that about a decade and a few years ago, about a decade and 2 years ago, in 2009, the world had to grapple with the swine flu pandemic, that is the H1N1. And just in 2019, SARS-CoV-2 also reared its ugly head. So it appears that even as efforts are put in place, there's a likelihood for these pandemics to recur. But it is his belief that if a treaty, a convention is put in place, we will be able to at least reduce the frequency of such pandemics. And even if they occur, the global community will not be caught flat-footed as COVID-19 caught each and everyone on this planet, just because systems didn't work, international health regulation processes didn't work to perfection, global leadership was also lackadaisical towards containing the disease right where it was. And as we all know, the human cost, the financial loss, the attendant job losses, and other adverse effects of COVID-19 have been grave and dire, and perhaps may count as the worst human tragedy since the world wars. But as we speak now, researchers are unable to tell what the long-term effects of COVID-19 will be on people who acquire the infections and survive. For example, it is known that in the long run, an infectious disease like syphilis will progress in some cases to even affect the nervous system. However, that of COVID-19, in terms of the long-term complications, are unknown. Even when it comes to COVID vaccines, which we all know at this stage is one of the best tools, if not the best tools, that we are deploying to manage COVID. It only prevents severe illnesses and associated death. It doesn't stop transmission. And so infections will continue to occur. And even in terms of distribution, acquisition and distribution of the COVID vaccines, there is acute inequity in access and distribution, particularly this is against the global south. We also know this pandemic could have been contained, as I have earlier on indicated. But for some lackadaisical attitude of global leadership at the time, bounded willpower, lack of the needed proactiveness. But we cannot repeat this mistake going forward as a people. This is why President Mahama fully supports the recommendations of the Independent Panel for Pandemic Preparedness and Response for a global public health convention to be established. For him as a historian, this quest for political leaders to tackle threats to the human race dates back to the 14th century in the Italian city-states. But even fast forwarding, you realize that towards the 18th, 19th century, the sanitation movement that also began should have served as a trigger to have aroused greater interest in the establishment of such global giant agreements, whether convention or treaty, that will be respected. Unfortunately, this has not been the case. And what we have seen is that over the period, we have seen different types of infections, either new diseases like HIV or SARS, which brought coronavirus itself to us. And then also Asian diseases, sometimes even diphtheria, re-emerging in areas where it has been eradicated, including tuberculosis, pulmonary tuberculosis in particular. And then novel agents that are also rearing their ugly heads. And so there is a need, if we are going to be able to prevent pandemics or even be able to manage pandemics better, then there is a need for a global agreement that will be respected by all. And this is why President Mahama is throwing his weight strongly behind the Independent Panel for Pandemic Preparedness and Response for the noble and restless quest to establish a global public health convention. He believes that when this is done, it has to be elevated to the level of the United Nations General Assembly, such that all member states and all UN organs will commit to it, even for the country that will have to take the document to their senates or to their parliaments for ratification and all. Once there is the commitment, he believes that can be done. And talking about other UN organs, this is where there can be a much more closer and productive collaboration between the World Health Organization and the WTO, because we all know that using COVID-19 as an index, the talk about vaccines, it should be possible for instruments under the GATS to be activated so that countries that cannot afford the vaccines that are being procured, over and above what the COVAX initiative is offering, can also activate compulsory licensing, para importation in such a way that they can also use their pharmaceutical industries in their countries, particularly the low and lower middle income countries, to produce some of the vaccines for citizens who badly need them. Also, this convention, this global agreement that we seek to have, must be anchored in the spirit of cooperation, solidarity, and equity. And we believe that if it is done, it will strengthen the WHO. This convention will serve as a scaffold that will help the WHO to do its work in a much more effective way than it has been able to do over the years. President Mahama believes strongly that this convention is about time, and we have procrastinated over the period, right from the 14th century, where political leaders had to take action, through the 18th, 19th century, 20th century, 21st century, and the clock is ticking. And the frequency of infections, emerging infections, novel infections, re-emerging of old pathogens are all knocking on our doors to tell us that the time to act is now. Fortunately, there is good news. WHO has shown commitment. And that is why the independent panel's work is also feather in the cap of both the promoters and the WHO that is also giving it all the needed support. This means that the WHO should continue to use its convening power, and I'm informed that in November, the World Health Assembly will hold a special session on pandemic preparedness and response. Hopefully, this will lead to further accentuation of all the ingredients that must go into the development of a convention on pandemic preparedness. Hopefully, this will not just stay in Geneva at the WHO headquarters. It must travel all the way to New York, where President Mahama knows that his good friend Antonio Guterres will be glad to use it for further action. But whilst we wait on the convention to prevent future pandemics, we must also deal decisively with COVID. And I'll spend the next few minutes to speak to that. President Mahama wishes to emphasize that we collectively curb COVID. He states that researchers must use appropriate modeling tools to provide likely future scenarios to enable governments, the private sector, civil society organizations, other non-governmental organizations, including the giant philanthropic organizations like the Gates Foundation and all, to be able to predict with a high degree of certainty what the socio-economic implications are going to be. This is the only way that appropriate remedies can be instituted to forestall the negative impact of the pandemic, which has been going on for the past 18 months and still counting. He also, as a former co-chair of the UN team that was promoting the sustainable development goals with the Prime Minister of Norway, Erna Solberg, is of the view that Sustainable Development Goal 3 is threatened at this stage by the COVID-19 pandemic. And this is part of the reason why the global community must act decisively. And in acting decisively, we should look at the triple helix of saving humans, saving animals, because the interaction between humans and animals is also going on, and that is also bringing about a lot of zoonotic conditions. And last but not least, also saving our planet. This is very, very dear to the heart of President Mahama, and he wants the team to take this on board. He also knows that no one institution can address it alone. No single government can address it alone. Even if you are a Goliath, the Davids in the nooks and crannies of the world, the Davids in the other parts of the world that are not so developed, permit my using this phrase, may brew some of these infectious pathogens, and with globalization, it may reach your shores. And so there need to be multi-stakeholder engagement, multi-stakeholder advocacy, so that all policy actors will come together and work to ensure this. And still on how we can work to prevent pandemics, and particularly with COVID. Only yesterday, at the John Snow Society annual pump handle lecture at the London School of Hygiene and Tropical Medicine, we observed that Dr. Fauci indicated that by 2022, quite a good quantity of vaccines would have been distributed across the world. But President Mahama is of the firm belief that 2022 will be too late. In conclusion, President Mahama is stating that if COVID-19 continues to ravage humanity, as we have seen, and we are yet to overcome it, then we must act as a consortium of the willing to avoid further pandemics. This is why he accepted the invitation to be with you, but for the urgent assignment that has taken him to the middle belt of our country. He wishes you great success in your endeavors as we all strive for a safer world. Stay safe and thank you very much.